When it comes to selecting Medicare services, there are multiple options, but according to enrollment reports, more than 22 million people enrolled in Medicare Advantage plans last year. These plans cover most Medicare services and offer extra coverage like vision, hearing, or health and wellness programs.
SCAN Health Plan is one of the nation's largest Medicare Advantage plans, and it's utilized by more than 200,000 people in the state of California. Here to discuss the benefits and how they are working to keep seniors both healthy and independent is the group's Chief Medical Officer, Dr. Romilla Batra. She's in charge of clinical policies and procedures, and she also oversees SCAN's clinical programs. Welcome, great to have you.
Thank you for having me.
Tell us a little bit about SCAN and how it helps seniors both preserve their health and maintain their independence.
SCAN is a health plan. It's 40 plus years old. As you said, it's one of the largest not-for-profit health plans, and our mission always has been to keep seniors healthy and independent. We started off as a social HMO by 12 angry seniors who felt that there was more to healthcare than just medical care. They felt like social care is a very important piece of it.
What is social care? What does that mean?
So what it means is, if you think about people, they are people. They're not members. They're not patients. They're not clients. For our overall health, you need good doctors. Yes, you need medications, but you also need other things that help you keep healthy and independent. So, for example, you need transportation to get to the doctors, correct? You would also need health and wellness benefit that keep you within your own home settings. You would also need folks who understand you and what your needs are. So yes, if you cannot pick up your medications from the pharmacy, you cannot take them on time and you would not have good outcomes. So we specialize in understanding the needs of these people and creating systems so they can get the best outcomes possible. And as a person, if you ask me what I need the most, I will never say it's just a good doctor or a good system. I want to be healthy. I want to be able to do what I enjoy doing. So a lot of our members will tell us, I want to spend time with my grandkids. So our goal is not to make sure that their diabetes is well controlled, but it's well controlled where they can do that, what they choose to do.
Right. Well, what are some of the biggest challenges that you face in doing this, in operating this type of health plan?
The biggest challenges that we face are around making sure we have enough systems set in place where we can understand the needs of a population, and we can design effective programs that can meet the needs of the population, and we are able to do that in a cost-effective manner so we can keep the cost down, and also we are able to do that in a person-centric manner. So my goals as a person may be very different from what your goals are, and we want to respect your wishes as well as my wishes.
So a lot of research is showing how important it is to keep people out of the hospital if you can. So what does SCAN do to help seniors in particular be able to get the care they need and the help they need at home?
So what we generally do is we approach it from, once again, a very person-centered manner. We try to understand what people's goals are. And we then try to match them with the benefits. As you had alluded to, we offer benefits that make things more accessible, they make things more affordable, and they make things more personal. So for example, if you can pick up your medicines, there are $0 copays, we are more likely to take them. If we have a system set up where a social worker can help you understand how to act on the plan that your doctor generated for you, what does it mean when you have to check your sugar 2 times a day because you have high blood sugar? What does it mean that you have to take your medicine 3 times a day? When are you supposed to take it? So we set up these systems, which are clinical systems, leveraging the clinical systems, but built around a person, their family, and their community setting that they are in.
How is your independence at how home service changing the face of the insurance market and how it's changing your own services?
So the great thing has been in the last year or so, Medicare has allowed us to offer certain benefits that we could not offer before. So for example, transportation is one of them. The other thing is when you get discharged from a hospital, perhaps you have access to the medicines, but you may not have access to a caregiver. You may not have access to meals because you're not in a position to cook for yourself. And so what we have been able to identify are these unmet needs, which are social needs. And so when you're getting discharged from the hospital, we have somebody who can deliver you meals that are appropriate for your disease. We can also provide you other services like in-home caregiving. So somebody that can help you take a bath or help you make your bed. Things that are not truly medical, but are really important for you to improve your health outcomes.
Right. What advice do you have for families who have an elder who's increasingly having more and more medical needs that need to be dealt with? How do you navigate that situation? How do you talk to them about it? How do you give them the care that they need?
It is very important to be engaged in the care of your loved one and understand what their needs and their wishes are. It's also very important to be engaged with your primary care team. And when I say primary care team, I very deliberately am not saying a primary care physician, because the primary care team will have a nurse, a person who works in your office, the social worker who can understand you best in terms of what your needs are, your pharmacist who can help you simplify your drug regimen. So be engaged in the care of the one you love through this extended team, which has providers, social workers, clinicians, and even your health insurance system that is building these systems that are building these benefits for you.
Final question for you then. What are the biggest challenges and the opportunities in the Medicare space over the next few years?
I think the biggest challenge in Medicare is going to be how do we make care which is not only affordable, accessible, and high quality, but more for me as a person versus for me as a patient. Because you're a patient, I'm a primary care physician by background. You're a patient 4 days a year, 6 days a year, but you're a person living in a community, in a home, in a group setting. So understanding the needs of each person and then helping them navigate the system is what I see as an opportunity for us.
Dr. Batra, thank you so much. Great to have you today.
Thank you,
so
Doctor.
much. I enjoyed it. Thanks.
And we'll have more Rising after this.